I haven't done a vlog in a while because I've been kind of busy and a bit depressed, but that's a different issue, not about my medical problems. I already had depression. Anyway, I decided that I'm neck fitting really bad and I need to do a vlog. And I thought I should keep everybody up to date about the medical part of the blog. So what I'm doing now, the subject will be my last MRI and some misinformation that happens in hospitals due to departmental type situations. And then I'm also going to talk a bit about how the COVID has affected the hospitals here. So the first thing is the MRI. And that went really smoothly. I did notice that there was some misinformation involved with where I was told at the end of my last visit at the radiation department that I had to go get an MRI. They said, you cannot eat or drink anything for 4 hours. And I was cool with that. That's not that bad. So the trick I did was I tried to sleep for the most part the whole 4 hours I couldn't eat. Of course, I had to get up a little bit during that to get ready to leave and go to the hospital. But considering that I was just going to be laying on a slab for a few minutes and then get to come home again, I didn't really have to have coffee or anything, and I could just come home and go back to bed if I wanted. Then I was told when I got to the MRI, they said, you didn't need to not eat. You could eat. I was like, well, that seems a little weird. How come they said I couldn't eat? And she said, well, probably because when we scheduled the appointment, we did not make a notation that you could eat. And she told you the information before the schedule was actually made. So I said, well, that's a problem not just for me, but for any patient. And I'm sure it's frustrating for staff as well, because they continually get the same question from patients over and over again when patients find out that has happened. So now I'm becoming a little bit of a patient advocate, and I spoke to my doctor at Mercy, the radiation doctor. He agrees with me that that is an issue that needs to be attended to, and he's certainly on my same page and says that he is willing to assist me with that by discussing it with his peers and the various departments that he works with. And his staff, his nurse that helps the patients that he has, and the desk staff and everybody else. So that is probably going to be a slow process right now, because as we lead into this next subject of the COVID, it's been a little bit frightening, the COVID, but I do want to stress that it's not like doom and gloom, okay? It's a virus. We can get a vaccine, and there are many, 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 many doctors and scientists all over the globe working hard on vaccines. They each have a different idea, and some of them are working together. And I know a lot of different doctors and experts have come out on YouTube saying, oh, it's going to be more than a year. But I have heard others saying that they think they'll be able to make it in 6 months. At any rate, we can slow this virus down and give ourselves time. This is something I heard from Dr. John Campbell in the UK, and he is on YouTube. He says, we can't stop it. It's too late to contain it, but that's all right, because we can slow it down, and we can protect those that are at the most risk, and hopefully, in doing so, give ourselves time to create that vaccine. That's good. The problem is there are a lot of people out there that don't believe in getting vaccines. That's their choice. However, they do affect the rest of us. So we will all still have to remain as vigilant as we have always been, in so far as every other virus we've ever had that we now already have vaccines for, that the people that don't want the vaccines At least we find out who they are so we can stay away from them. Since they have no interest in whether they're protecting other people or not. So the next subject was how it affected our hospital. And what they've done here is we are all now required to report 10 minutes early to any appointment. And so if you're going to appointments where they said you need to be there 15 minutes early, you need to add another 10 minutes on top of that. This is so that when you go in the hospital, you have plenty of time for them to ask you the questions about whether you've traveled to certain places or have had contact with anyone that's been to those places or have had any contact with anyone that has or may have the virus. And then they will take your temperature. And for us, they gave us a little piece of colored tape to put on our shirt, so that the rest of the staff could tell that we'd already been cleared. And they're doing that for everyone that enters the building, regardless of whether they are staff, visitors, or patients, or even security or police. And ambulance drivers, everybody has to get that check. And secondly, the inside the building, when we went to the desk to, be registered as having arrived, we were they had laid tape down on the ground. We were supposed to stand behind the tape. And they, had the staff all wore gloves everywhere. They had one staff member whose sole task was to continually walk around the waiting area and wipe off surfaces with disinfectant. And there were numerous extra hand foam stations with the sanitizer and numerous offers from staff pointing out as we would move along hallways and whatnot, if you want to do that, there's a hand foam station right there. So I felt very protected from the coronavirus in that situation. It really gave me comfort to know that the hospital was taking those extra steps. There was no extra masks. For right now, they're only going to give those to people who already have symptoms or have been tested. But that's, because there's very shortage of those masks. And then at the end of the MRI, the whole thing went very smoothly. It was quite quick. And as I described in my previous video, there was plenty of headroom. It was like that. And they even had a fan, like at the back of the machine, just a regular fan, so that sound would help with this claustrophobia, which some people it does help. I was fine. I had no problem at all. But then let's see, there was in and out there, and then set up the next appointment, which was my radiation treatment. I did have one. It was way faster than I expected. Like, I was literally inside the machine for like 10 minutes. And I didn't feel a thing. The whole time there was no pain, no heat. I didn't feel sick at all. I didn't get lightheaded. It was perfectly fine. And so after that, I had my first chemo treatment, and that started out really well. And the whole thing went really smoothly, and it was quicker than they thought it might take up to 4 hours. But since I was tolerating the intake of the medication very well, they went ahead and notched it up a little bit so it was going a little faster, and I ended up getting done in 3.5 hours. This is smoker's cough. This is not COVID. The next thing after the chemo, and they were very thorough with telling me about each and every symptom I might possibly get. As I said in my previous video, and they told me that just because they say it's a possibility does not mean that that's going to happen to you, and you should not allow them telling you that to make it set in your head that you'll get that. Because if you already believe that you're going to get something, you can actually cause that problem yourself. Mentally, your brain can do that to you. It controls your body. So the problem is we don't have enough control over our brains to make it heal our bodies yet, but hopefully someday we'll evolve that far. I realize my eyes look a little red and stuff. It's partially the lighting in my room, and it's partially because I was just rubbing them because I'm sort of fatigued. So my symptoms from chemo so far I've not had any hair loss yet. It's fine. And I was fatigued and slight nausea, but I'm not vomiting or anything. They did give me an anti-nausea med with the infusion, so that's probably helping some. And I am going to be getting a pill form of that in the morning when the pharmacy has caught up with all its prescriptions. So, and then I did want to tell you a little bit about this other test I had. And it was extremely unpleasant. I mean, the test itself, they numb you up for. It's called a lymph node biopsy. And they do numb you up really well for it. And I did want to mention that every time I've had a needle poke, I don't know if staff are just being trained better or they've just had a lot more experience since the years I was going to doctors previously. But no matter what kind of needle poke I'm getting, they really haven't had any pain. They've been doing such a bang-up job with that. It's really great. And then that involves the lymph node biopsy, which does require needle pokes. But the needle is super thin. It's like the thinnest needle they've ever used on me that I've ever seen. The other part of that is it's a vacuum needle. And they need to do that because they are trying to get cells from down inside your body without being overly invasive. So this will be something they can put directly where they need to get the cells from and activate the vacuum and get their sample without having to cut you. And the lymph nodes they tested for me were in my lower half. And yes, afterward, like a couple hours afterward, I was in a lot of pain, which I think was probably partially my fault. The practicalities of life and the COVID virus, having to stock up on things like food and toilet paper, I decided that since I had a ride that day, I would take the opportunity to go and do some shopping. And so, because I'm too proud to ask for assistance, I didn't get into one of those carts you can drive around or anything. I just went ahead and walked around with my son in the store, and he kept saying, "Mom, don't you want to sit down?" And I was like, "No, I'm fine. There's not enough room in the aisles for me to be riding around on one of them things anyway with all these freaky people in here." And yes, there were so many people at Sam's Club that the lines were literally extended all the way back into the store. But I did get my shopping done, and by the time I got home, I was well and thoroughly ready for a rest. I was in pain. I took a couple of ibuprofens, even though I've been told that that will damage my kidneys further. I can't really take aspirin. I can take Tylenol, but I already have an enlarged liver from taking too much Tylenol and ibuprofen for my teeth in the past. So, unfortunately, I really don't have much option when it comes to over-the-counter painkiller, and I guess I figured I have 2 kidneys, but only 1 liver. So, I took ibuprofen. Next time I'll probably take Tylenol, and hopefully by the time I get back to the hospital, they will be able to help me with a prescription for pain. And I was supposed to get another radiation treatment today, but they had to cancel that because the machine has a malfunction, and I'm going to go ahead and go to my regular treatment tomorrow. I have radiation 5 days a week and chemo 1 day a week. And as I said, I'm not really allowed to video in any of the patient treatment areas. And certainly they don't let me take my phone into the radiation area. But in the chemo chair, there are lots of times when I might be able to get a little bit of video in. So, because I'm sitting in a chair and there's a curtain I can pull. And, I'm sure I can get a little bit of video of the area. Oh, and the other changes at the hospital were that staff would be passing out snacks. Normally, they would have like a basket with some granola bars and such sitting on a table or a counter, and people would just go grab that. They had bananas in the past, and I just, really enjoyed that aspect, because my dad, when he went, he would really enjoy that perk. And even though some people that were involved in helping him with his care had a more strict approach to the grabbing of the freebies, every nurse and every staff member told me personally that that is exactly why they are there. When you have cancer and you have to go through that chemo, you need to feel special, because it makes you help your healing. Your brain produces endorphins that can promote healing throughout your body. So when you can walk up to a counter where there's a bunch of free, really pretty little earrings people handmade, and other types of jewelry, blankets that people have handcrafted, food you can pick up, lots of choices. They had all kinds of Nutri-Grain bars, Lorna Doone cookies, like I can't even tell you the variety. And you have free beverages. They have a load of variety of beverages. And every once in a while there's a volunteer who will run around with a crate full of sandwiches. You have a good variety of sandwiches, cheeses, Jack Links, all kinds of snacks. And before, you could just walk up to the counter and grab, as I was saying, but now they had a sign over the refrigerator area: let staff bring you drinks, let staff bring you snacks. And that's okay, because when you have cancer, let me tell you, honey, I don't care what anybody else says. That sucks. Chemo sucks, no matter how comfortable, no matter how pain-free you're sticking. You know it sucks. It does. And I'm sorry, but there's no way around that. You deserve to be served hand and foot. And those people in that hospital, they know that. The staff knows that. So you let them serve you hand and foot. They're happy to help you. Happy to. And so I guess the next step will be my radiation on Friday. And then I have the whole weekend to just rest up. And I'm not really sure how much rest I'm going to get, but, with 3 cats around, I'll always have entertainment. And that's one of the most important aspects is, you can't sit here and worry about your next treatment, or if you're going to even get to go because of COVID or whatever. Worry does not serve any purpose. It just drains your energy and makes your body not heal as fast as it could. So my advice to you: find something you really enjoy looking at or doing with your hands that you can just sit and relax and do for hours and lose yourself in it. Because you gotta comfort yourself more than anybody else can comfort you. And I personally have a problem when I can't find a comfort of my own, and I don't want to bother people that I love. I feel like I don't want to burden them, even though I know they're sitting there telling me that they love me and I'm not a burden. Don't hesitate to call. I know they have their own problems. I know they have their own lives. I'm not blind and I'm not an idiot. And I know you love me. But I'm a big girl and I can take care of myself. I'll be all right. And so will you. We're all in this together. All my love. Bye.